Hello, and welcome to the Latch Lounge podcast. Today, we are going to be talking about something that I get asked about in every single prenatal consult that I do. And that is, how do we optimize and get the most out of those first few hours after baby arrives so that we are certain we are doing everything we can to set ourselves up for the most successful breastfeeding journey possible? I'm Amber Ginn, IBCLC, and empowering moms in their breastfeeding journey is what I do. Breastfeeding comes with a lot of opinions. Your doctor, your mother-in-law, that random lady at the park, and it can leave you feeling like you're constantly second-guessing yourself. That's why I created the Latch Lounge podcast, to cut through the noise and give you real, judgment-free, no BS advice that actually helps. Whether you're nursing, pumping, or combo feeding, this is the place for you to get the real support and information you deserve. So grab a drink, get comfy, and let's get into it. So we have so much talking online about the golden hour and all of this that I feel like in attempting to focus on something good and important, we're overshadowing all of the other hours postpartum that are also so important to our breastfeeding journey. So let's get into it. First things first, let baby latch when they're ready. The worst thing that I can think of for both mom and baby when it comes to your baby being freshly laid on your chest is a stranger coming in and forcing, for lack of a better word, you to attempt to latch your baby before you and baby are ready. There is absolutely no reason to rush that first latch. We want to be respectful of baby's physiology, of their instincts, and we want to be respectful of our own instincts as a mom. And if your baby is freshly laid on your belly and you don't really feel like you need to bring them up and start stuffing things in their mouth, don't do that. My biggest piece of advice for new mothers that I work with prenatally is get comfortable telling people no thank you. If the lactation consultant or bedside nurse in your labor and delivery room comes up to you after baby's been placed on your chest and asks, hey, do you want me to help you get a good latch? You can say no thank you. If they start to grab at your baby without saying anything, as can happen sometimes, you can say, please stop. No thank you, I don't need any help with latch. I'm just going to wait until baby's ready. So with that said, when do we need to worry? At what point does baby need to have latched? Well, in short, it depends on a couple of factors. If you are gestational diabetes positive or your baby has any pre-existing conditions that makes us concerned about their blood sugar, we want to be respectful of that and keep an eye on things. That doesn't mean that we need to rush a latch necessarily, but it does mean that we need to have a plan for getting nutrients into baby to support their blood sugar if that's a concern. So you definitely want to have your baby on your skin to skin with you for that first hour, but the first hour is not the only hour that matters. I tell all of the moms I work with, uninterrupted skin to skin with your baby until there is a baby-led first latch that's effective and comfortable where baby gets to nurse for as long as they want to and comes off naturally. That's how long we want to have that skin to skin time. We don't want to say, oh, let's just have a golden hour, and then after that we have mother-in-laws and everybody and their mama coming in to hold the baby and look at the baby and talk to you and ask you questions and take pictures. We don't want that. We want to be very respectful of this infinitesimally small blip of time that we have with our newborn, and we want to not rush it. We want to let baby be skin to skin with us and take their time. I would say for most healthy moms and babies, we can be pretty comfortable with baby taking their time to latch within like a 4-hour window of baby being born. So let's say baby's born at 10 a.m., then by 2 p.m., we definitely want baby to have latched at some point during that time. If for some reason you are concerned about blood sugar or other things are happening, then there's other asterisks there to what we want to be thinking about. But generally speaking, up to 4 hours, completely fine. I've had certain clients across time, mostly those who've given birth outside of the hospital setting, who have waited 6-8 hours before being concerned about intervening or trying to encourage baby to latch. Everyone should do their own research, work with care providers that they trust, and make decisions around interventions based on their own goals and opinions and understanding of risks and benefits. So beyond that, when should baby get a good latch? Let's expand the time frame out a little bit further. I have so many moms who they've heard about the golden hour, they hear about skin to skin right after baby's arrived, and then they kind of forget about skin to skin across time. So, if for some reason you miss out on the opportunity to have skin to skin immediately after your baby arrives, you most definitely can enjoy the benefits of that at any point whenever you and baby are reunited. So, whenever you and baby are reunited, if there was a separation immediately after baby was born, implementing skin to skin is going to benefit you both immensely. I always tell moms we do not want to limit skin to skin to the first few hours, we don't want to limit it to the hospital. Skin to skin is going to benefit you and your baby so, so much. When we think about lactation, there are two main hormones. There's a lot of hormones, really, but there's two main hormones that are going to drive your experience of producing and feeding your baby milk. The first is going to be prolactin. That's going to be what tells our body to make milk. The other is going to be oxytocin, which is what's going to tell our body to eject milk. Both are extremely important, and oftentimes we overlook the importance of oxytocin. We want to be oxytocin maxing when we are breastfeeding mamas. We want to be getting as much oxytocin as we can. One of the great ways to do that is skin to skin with your baby. I have so many moms who are in a big rush to get their baby dressed in an outfit, to get them in a swaddle. The best thing you can do is keep your baby skin to skin in the breastaurant, as a good friend of mine called it, so that whenever they are ready to eat, you are going to be able to pick up on those hunger signals straight away. The last thing that we want is a baby that's too comfortable. I know that might sound a little bit funny, but really when babies are wrapped up really tightly in a swaddle, they're in a snoo or something like that where they're being overly comforted, it's really, really easy to miss those initial hunger cues. And when we miss them and we start to see that baby's hungry, when we're seeing those later hunger cues, what we're dealing with is a frustrated baby whose blood sugar is not having any of the nonsense and they're ready to eat like 5 minutes ago. And if you're still learning how to latch, if you're using a nipple shield or some other contraptions to help you along your breastfeeding journey, which no shade there, but if you are, that makes it all the more difficult because you have a squalling, wiggly baby who's too hungry and now you're fussing and fighting to get them to latch. That's the last thing we want. So let's talk about when you need to be worried about adding formula or supplementing during those first few hours after baby arrives. So as I mentioned, we in most cases don't need to be worried about baby latching for the first couple of hours, but we have a lot of well-meaning doctors and nurses who can push the need to supplement with formula, who can encourage moms to just go ahead and give a bottle, and who can tell moms that they need to pump right after baby's born. In a situation where mom and baby are kept together, there's really no reason to start pumping if your plan is to feed exclusively at the breast. Even if your plan is to feed exclusively at the breast for a short period of time, or you're not really sure how long you want to do it, do not start pumping unless pumping is your goal. I have so many mothers who I meet postpartum and they're telling me, yeah, I started pumping a couple hours after baby was born and I've been pumping and I've been feeding baby and I feel like I'm not getting that much out of my pump and baby doesn't seem like they're full. And it's like, yeah, because we weren't really designed to do both things. In most cases, we have singleton babies, so our bodies were designed to make enough milk for one baby. And when we start pumping and latching baby, our bodies are getting mixed signals and we're not going to really be good at either. It's one of those things you're spreading yourself too thin. If you're an exclusive pumper, that's your goal, that's your plan, by all means, start pumping as soon as you'd like. But if your goal is to feed exclusively at the boob, then we want to be respectful of that goal and not introduce a pump too early. Another thing that a lot of moms don't keep in mind when it comes to pumping in the hospital, it's almost guaranteed that the flanges that they have, assuming that you don't bring your own pump, if you're using the pump in the hospital, it's almost certain that the flanges they have are not going to be the ones that fit you. So that is a big consideration. If you're planning on pumping postpartum, bring the pump that you plan on using at home with you. Make sure your flange is sized correctly. A lot of times in the hospital, there's a lot of stuff going on, and I've had so many moms come to me who were sized in the hospital incorrectly, and we do not want that. Another thing I really want new moms to understand is there is no schedule for how long your brand new to this earth baby is going to eat. Please do not let anyone pressure you or cajole you into thinking that your brand new newborn needs to nurse for 7 minutes on the left and then 7 minutes on the right. And then in 2 hours, we're going to do that same thing again. You are more than welcome to do whatever the hell you want, first of all. But in this context, to provide a little bit more helpful information, you are more than welcome to let your baby latch and let them stay latched as long as it's comfortable for the two of you. Babies are not robots, and they don't typically care much about our schedules, wake windows, or any of that stuff. With that said, if your baby is latching and it hurts, that is not optimal. Is it normal? Yeah, obviously. Plenty of mothers struggle with pain during breastfeeding, either in the beginning, a few days after, what have you, but it is not optimal. It is not what we want to see. If you're noticing that your baby is clicking, squeaking, doing any stuff that's feeling a little bit off, be sure to reach out to lactation care so that you can get the support you need. In my private practice, I work with moms all across the US, and we get dialed in on what is going on so that mom can have a comfortable and empowering experience with breastfeeding. Lastly, I just want to talk about one thing that we see covered and highlighted on social media all the time, and that is oral ties. So tongue ties, lip ties, cheek ties, all of that fun stuff. So a lot of moms come to me and their baby is struggling, they're in pain, their nipples are cracked, baby's not gaining weight, all of the things are happening. And they tell me, well, baby doesn't have a tongue tie because the pediatrician in the hospital checked him. To that, I always ask, how did they check him? Did they glance in his mouth momentarily with a pen light, or did they glove up and spend several minutes palpating and examining and evaluating all of the different oral tissues of your baby's mouth? Because if it was the former, they did not check. They just glanced, and they were looking for probably the world's most prominent tongue tie, and that would have been the only thing that they noticed, and in some cases, they missed those as well. If things are hurting, if they are not feeling right, if you are struggling, don't let anyone tell you that everything is okay if you feel that it is not. While breast pain, nursing pain, low milk supply, all of these things can be normal, they are not the way our bodies were designed to function. Our babies were designed to be good, efficient eaters. Breastfeeding was designed to be a comfortable and joyful experience. And if you are having an experience that is anything less than that, then get help and seek out help from someone who resonates with you, someone who's going to listen to you and love on you and care about you and center you as a decision maker in everything that's happening, who's going to listen to your goals, help you understand why those are your goals, and help you make a plan that really works for your life. I've had several moms over the past week or two come to me, and I'm the second, third, fifth IBCLC that they've seen, and they were getting to the point where they're like, I think all IBCLCs are useless, which I hate to hear because I know we're not, but it's just because they had landed in front of the wrong IBCLCs. But the great thing is that they kept looking. So if you talk to an IBCLC, a lactation consultant, a breastfeeding specialist, etc., and you don't feel that they are aligned with supporting you and your unique goals, if you don't feel that the vibe is there, talk to someone else. For certain plans like Aetna, we do have to be respectful of the fact that we have limited visits, so doing as much research as you can beforehand is super duper important, which is what I love about being able to have a podcast, because I'm able to kind of give all of you wonderful mamas a view of kind of how I think and how I approach my care. But don't feel like you're stuck if you talk to an IBCLC that you are not vibing with. I've had moms that I've worked with who for their first or second babies worked with an IBCLC and had such a bad experience that they never reached out to anyone else again. But all that to say, the first few hours after baby arrives is extremely important, but it does not mean if it doesn't go correctly that you're totally screwed. So if your first few hours with your baby did not go the way that you wanted, just understand there is so much you can do to get things back on track. All of these things that I've talked about today are really important, especially being able to find really good care that's aligned with you. I hope that you've all found this really, really useful, and just remember that those first few hours really matter, but our bodies and our babies are very resilient, so if things didn't get off to the right start, there's always so much you can do to restore your breastfeeding journey to an empowering and joyful experience. That's it for today, Mama. If this episode helped, don't stop here. Get even more support at thelatchlink.com. Need one-on-one help? Did you know your insurance covers free lactation care? If you have Aetna, Anthem, Cigna, Blue Cross Blue Shield, or UHC, you can get free virtual lactation care right from the comfort of your home. Check your coverage and book your session today at thelatchlink.com. And if you're looking for instant help with latch issues, grab my course, Latch Legend, for step-by-step fixes you can use right now. If you love this episode, subscribe and leave a review. It's the best way to help other moms find the support they deserve. Until next time, trust yourself, trust your baby, and know you are doing an amazing job.